Welcome to Live Well with Southwell. I'm your host, Liza Tillman, and today we're joined by Dr. Brisandi Villar, hospitalist and chair of the Infection Prevention and Control Committee at Tift Regional Medical Center. Dr. Villar is here to talk about a critical health topic, sepsis. We'll cover what sepsis is, what causes it, and why it can be so dangerous, and most importantly, how to act fast if you or someone you love might be at risk. Let's get started. Well, thank you so much for joining us today, Dr. Villar.
You're welcome.
Yeah, it's great to have you. So first of all, start by telling us, what is a hospitalist and why is sepsis so important to you as a hospitalist?
Yeah. Well, a hospitalist can be an internal medicine or family medicine specialist that works inside the hospital caring for patients that are, in the hospital because they are sick. They have an acute illness. Well, sepsis is very important for us because, believe it or not, every 2 minutes, one person dies of sepsis in the world.
Wow.
And we see it all the time. And if we don't act fast, people can die of it.
Wow. So as a hospitalist, you don't see patients in an outpatient setting. You're just in the hospital, right?
No. Unfortunately, still I'm not outpatient. Every patient that I see asks me, do you have a practice?
Yeah.
But no, we only see people who need us because they are, acutely ill in the hospital.
So you see a lot of sepsis patients, and that's why this is so important to you. So let's start by talking about the big question. What is sepsis?
That's a great question because it's a fancy name.
Yeah.
And then, sepsis is the overwhelming and uncontrolled response of the body to try to fight an infection. Instead of fighting the infection, our immune system, the defense of the body, just attacks the other organs. And then basically that's what happens. So
it's from any infection, not any particular infection, just any time that you have an infection.
Yes, it can be from a lung infection like a pneumonia or the flu. Can be from a bladder infection like a UTI that sounds simple, but it can trigger sepsis. Can be from a wound infection or a cut that we didn't take care of properly, and that can trigger sepsis. Any kind of infection can produce sepsis.
Why is it so dangerous? You said, what was the number you said? Every 2 minutes?
2 minutes.
Okay. Why is it so dangerous?
Because if we don't act fast and we don't treat it fast, it can cause multi-organ failure, what means that all the organs in the body will shut down and the person eventually will die.
Wow. What are the causes of sepsis?
Any infection can cause it. Actually, the most common cause of sepsis is pneumonia. So what is pneumonia? It's a lung infection. Can be from a bacteria, can be from a virus like COVID, like the flu, like RSV. Can be from a fungal infection. And some people go out to the woods and they have some contact with mold that can infect the lungs and then can trigger sepsis. Can be also people that have surgery and the wound gets infected or something goes wrong with the surgery and get an infection that can trigger sepsis. Or can be, for example, after delivering a baby. Women can get infection and then get sepsis. It can happen from a tooth infection also. Can also produce sepsis, yes.
And it's not something that you just acquire in the hospital. It can be any infection that you've got at home or otherwise.
Absolutely. I can be cooking and get a burn in my hand and I didn't take care of that wound and it got infected and then my body tries to fight this and I start fighting myself. I got sepsis.
Wow. Well, what groups are at higher risk for sepsis?
Oh, that's another good question. 65 and older, so elderly patients, young kids and babies, also pregnant women. Because our immune system changes during pregnancy. Also, people who have chronic conditions like high blood pressure, diabetes, cancer, COPD, which are very common, unfortunately. Or people who are in treatment that weaken the immune system, like people with cancer that are on chemotherapy.
So that particular group. Can you talk to us about recognizing the signs and symptoms of sepsis? Because I think, like you said, this is kind of a fancy word, and we know about infections, but especially if you are at home and like you said, you've burned yourself or you've cut yourself in the kitchen, what do people need to look for to recognize sepsis?
Yeah, so there's an acronym for this. It's time. The T is for temperature. Can be either high temperature like fever or low temperature feeling cold. The second letter of the acronym is I. It's for infection. You might know that you have the infection, or you can have symptoms of an infection. For example, if you have a lung infection, you will have cough, shortness of breath, some phlegm coming out. Or if you have a bladder infection, you can have like burning in your urine or some blood in your urine. If you have a skin infection, it's very easy to recognize. It's swollen, it's red, it hurts. Or if you have a wound infection from a surgery, or you will have some discharge around it, or some swelling and tenderness in the surgical area.
Okay.
The next letter will be M. This is for mentation. And then is any change in the mental status of a patient, meaning I'm confused, I want to sleep a lot and don't want to wake up. Something that simple, like, oh, he got a cold and now he's sleeping all day. This could be sepsis.
Okay.
It's not normal that somebody with a simple cold wants to be sleepy all day.
Okay.
And then the last letter is the E. It's called extreme. Like, and then that's when you have to think that a cold is more severe than a simple cold. For example, extreme body pains, extreme shortness of breath, feeling that your heartbeat is very fast, all those extremes that don't look like a usual infection. Like you can think like, oh, this might be sepsis.
Okay, I gotcha. So just really knowing those signs and symptoms. We hear about the acronym for stroke, but this is it's kind of a newer one, right, for sepsis.
Yeah.
Why is it so critical to act fast by seeking immediate care when you think you might have sepsis?
Because it's a life-threatening emergency.
Yeah.
Like, people die for it all the time. And we need to act fast and appropriately treat it so the person can get better.
Yeah. So they would need to go to the ER right away.
Absolutely, right away.
Or call 911 if you can't drive yourself. Right?
Yes. The same that you do for a stroke, like everybody knows, like if you have these symptoms, it's a stroke, go to the emergency room. The same, you have those symptoms, it could be sepsis, go right to the emergency room.
And what are the treatments for sepsis? What happens if you were to come to the emergency room and they determine you have it?
Yeah, well, that's a great question again. Like, we have to give IV fluids, a lot of fluids, okay? IV antibiotics. And we also have to do some other stuff like take Holters and check some levels in your blood to determine how severe is the sepsis.
Okay.
And then the treatment will go depending on what the infection is. But basically, fluids and antibiotics, but they need to be given right away.
What would you say the time frame is if you feel like you might have sepsis and you're experiencing these symptoms? How much time do you really have before you need to get to the hospital?
You need to go right away because the survival is better if I am able to give this patient the fluids and antibiotics that they need within 1 hour of the sepsis being diagnosed.
So it can be as short as 1 hour once you recognize that these symptoms are.
So, and not 1 hour to get to the hospital.
Right.
1 hour from the moment you think you have sepsis to be all the way in the hospital getting treated for it.
Okay. So it's so critical to know what those signs and symptoms are. And especially if you are sick, the internal things might be a little bit harder to identify. But if you're sick with, like you said, COVID or the flu or just a cold or things like that, to follow up with your doctor and make sure that you're letting them know of any symptoms that you're having, especially if the treatment isn't working with whatever they've given you. And I know especially after a surgery, they're very particular about, making sure you keep that wound clean and everything, and just don't hesitate is what I'm hearing. Right.
Absolutely.
Okay. And now, how can you prevent sepsis? Is it preventable?
Oh, yeah.
Okay.
Well, simple things like washing hands often.
Okay.
Stay away from others if you are sick so you don't spread something. Also, keep up with your vaccinations like the COVID vaccine, the flu vaccine, the pneumonia vaccine. And also, the most important thing, if you know the symptoms and you are aware of them, as soon as you feel something, just go to the emergency room.
Just don't wait.
Don't wait.
Okay. And don't be stubborn.
No.
And
please.
And yes. And think that it's going to go away.
Yeah.
How many patients do you see usually a week or a month that have sepsis? Is it a lot?
I will say, and we work 1 week on, 1 week off. And I'm going to tell you, like, in my list, I normally have like 16 patients. From those 16 patients, like at least 5 have sepsis.
A week?
Yeah.
Oh my gosh.
Yeah.
So it is very prevalent.
It's very common.
It's from
anything.
Anything. All the things that you just mentioned. There's not one thing over the other. It's just any infection that can happen.
Yes.
It is deadly. Wow. Well, we really appreciate you coming and spreading the word about it. I know September is Sepsis Awareness Month, so I know this is why it's important to you that we get this message out. Is there anything else you'd like to add about this?
I just want to say, if you think you have it, just run to the emergency room.
Okay.
We will be happy to help you. The soonest we help you, the better the prognosis is.
Would you say when somebody goes to the emergency room, right away say, I think I have sepsis?
Yes, please.
Yeah, don't wait around. Just go ahead and tell them, because I think that from what I understand, your symptoms, you'll probably be seen very quickly.
Oh, yeah,
if you tell somebody that you think you have sepsis.
Oh, yeah, absolutely.
Well, thank you so much for joining us today, Dr. Villar. We really appreciate you coming by.
Thank you.
Thank you, Dr. Villar, for sharing such important information about sepsis. To learn more about sepsis, you can visit sepsis.org. And thank you again for listening to Live Well with Southwell.